your doctor just dropped the prediabetes bomb. Now what? So if you've just been told that you have prediabetes and you don't know where to start and what to do, I'm Dr. Marianne Martin, aka Dr. Hormone Hacker. And today we're going to talk about what should you do when you're given the diagnosis of prediabetes and where you should start. So let's break it down with facts and not fear. First of all, what does it mean when you're prediabetic? It just means that your sugars are higher than what's considered normal, but not high enough yet to qualify for diabetes. And it can be made in a couple of different ways for diagnosis. Number one, you have a fasting sugar in the morning between 100 to 125. Number two, you have an A1C, which is a 3-month marker of all of your sugars that falls between 5.7 to 6.4. And number three, maybe you were asked to take a 2-hour glucose tolerance test where you have to drink this super nasty sweet beverage. 2 hours later, if your sugars fall between 141 to 199, that's also prediabetes. Here's what's really shocking. 96 million Americans right now have prediabetes. That's 1 in 3 people. And 80% don't even know that they have it. But here's the hopeful part. There was a huge trial called the DPP trial, which showed that just basic lifestyle changes in diet and exercise actually prevents the development of type 2 diabetes by 58%. That was double of what medication was able to do. So prediabetes is absolutely treatable, reversible, and preventable. So here are the most important steps you can do right now. Number one, let's fix your plate. You want to make sure that you are focused on protein and fiber first. You're pairing your carbs with fats or protein, and any ultra-processed carbs, you don't want to have that late at night. So if you just change the order of the way that you're eating, having your protein and veggies first and then your carbs, that alone reduces your glucose by 30%. Number two, you want to walk right after meals, even just 10 or 15 minutes. This is the most crucial time that helps to reduce your blood sugars the most. Number three, let's protect your sleep. Even one night of just a little bit of poor sleep increases your sugars by 20 to 30%. Now, if this is chronic and you have 3 or 4 nights or more in a row of poor sleep, now it's going to raise your cortisol, which also raises your glucose. And finally, you want to build muscle. Every pound of muscle that you gain improves your body's insulin sensitivity, even if you're not seeing any weight loss on the scale. I always recommend starting with lifestyle, but if you need an extra boost, here are a couple of things that you can consider. When it comes to medication, metformin is usually the first medication that's started. And in that large DPP trial, it helped reduce the development into diabetes by 30%. Now, the other medication that is also useful are GLP-1s like Ozempic. This can reduce A1C by 1 to 2%. Now, if you want to be more on the holistic side, there are a couple of really amazing supplements. Apple cider vinegar, maybe a teaspoon taken before each meal, can help reduce your glucose spikes. Chromium picolinate taken after your meals can reduce glucose spikes. And berberine has actually been shown in some studies to be just as effective as metformin. Now, none of these are magic fixes by themselves, but when you pair these optional boosters with a really good diet and exercise plan, that's the game changer. Just remember, you didn't get here overnight, and you're certainly not going to fix it overnight. But if you sleep, eat, lift, and move, you are going to be able to really have the consistent habits that'll help you hack your way back to normal sugars. If you found this helpful, please make sure that you share this with someone who might be struggling with prediabetes or diabetes. I am going to continue to drop a lot of information on how to prevent prediabetes and diabetes. So make sure that you subscribe to the YouTube channel. Now that I know better, I do better, and I want to help you do better too.